1. I'm not a doctor, but here's the most ridiculous thing a doctor ever told me. I work as a microbiology lab technician in the hospital, and a fully certified doctor asked me why I couldn't just microwave the petri dishes to speed up bacterial growth to figure out which antibiotics to use. Seriously. 2. Oh man, this guy thought marijuana could cure anything. He had itchy ears, maybe eczema. He stuffed weed in his ears. He did this for 2 weeks, got irritated, and got an infection. Had to remove it and sterilize it. What? There was a man with diabetes who thought that freezing his soda into a popsicle would turn it into an icicle without sugar. That day, we had to explain what ice actually is. A guy with diabetes tried to tape his rotting foot back on. He developed sepsis. Maggots were involved. One guy zapped his penis with a 9-volt battery regularly for his herpes. He used the same method for other health issues too. There was also the man who hated water and never bathed. He didn't leave his house because he didn't like people but enjoyed church. The local church tried to help him, but he smelled so bad they told him he couldn't come back. He didn't like toilets, so he relieved himself outside. Somehow he's been married and divorced 3 times. Another lady who was always dizzy regularly drank a whole 12-pack of soda and was surprised that she felt dizzy afterward. She didn't realize it was because she was drunk. There was also a man who called an ambulance, pointed a gun at the paramedics, and still went to the hospital. He also tried to rob the home health nurses when they came to assist him. He went to the hospital because he thought his soup tasted bad. He stayed for a week demanding special diapers and complaining about the lack of HBO and bad soup. A woman screamed at me in the ER, denying that the MRI was showing her was hers, even though her name and body shape were visible on the image. During COVID, many patients denied they were sick until we had to intubate them. They were coughing, hacking, and struggling to breathe, even with BiPAP. They still blamed me for making them sick. Most of them died of multi-organ failure after being on the ventilator for 2 to 4 weeks. One man came in with gonorrhea from an orgy during the 2020 lockdown. He was shocked when I was surprised. "But I wore a mask," he said. My response, "But no condom?" There are plenty more, unfortunately. 3. As an EMT, I once responded to a call about a severely bleeding hand laceration. When we arrived, the young woman, around 18 years old, was holding her hand in pain. However, I noticed the lack of blood and asked her to show me the wound. It was only a cut about 1 centimeter long. She explained that her family didn't own any bandages and didn't want to go to the pharmacy to avoid getting an infection. 4. I had a patient who crawled under his truck and tried to press his engine back into place just 2 weeks after a total hip replacement. He came to the clinic complaining of pain. 5. A woman in her 50s came to the ER complaining of difficulty using her left hand. It turned out this issue had been present her whole life. She was right-handed. 6. My mother had a patient, an elderly woman, who was rushed to the ER after ingesting bug spray. After stabilizing her and admitting her to a ward, Mom asked why she had done it. The woman replied, "I accidentally swallowed a cockroach, so I took the bug spray to kill it." 7. I had a patient with repeated infected leg ulcers. The reason? Instead of cleaning and dressing them as instructed, she let her dog lick them clean. 8. As an optometrist, I've had some unforgettable moments. One patient insisted that urine eye drops had healing powers. When I asked where she got them, she revealed she took them directly from the toilet and put them into her eyes. I begged her to consider the risks of bacterial keratitis, but she didn't listen. Another time, a patient came to me about 6 months after a severe eye injury. He'd lost vision, but thought he could walk off, a total retinal detachment. If I had a nickel for every time this happened in the 3 years I've been practicing, I would have 2. Not a lot, but still strange that it happened twice. 9. As a pediatrician, I deal with many cases daily. I truly empathize because as parents, you'll always worry about your kids, and sometimes logic goes out the window. A lot of families come in for fevers of 99 degrees Fahrenheit, where Tylenol helps, and they wait for hours just to see their healthy child. It saddens me that they waste their time in such stress. Even worse are the parents who avoid Western medicine for their kids with severe chronic illnesses like IBD or lupus. Instead, they opt for natural remedies like baking soda, which only causes their children pain and irreversible damage. It's especially infuriating when they refuse necessary surgery for their babies, who have serious congenital issues unless it's bloodless, which is another irrational conversation on its own. 10. My mother worked as an ER nurse for 30 years and has countless stories. One time, a man came in because his legs weren't working. When asked if he had any prior issues, he said no. He seemed confused, so Mom dug deeper and discovered he had been taking painkillers non-stop for over a week after injuring his leg at work. He had broken his leg but kept walking on it while numb from the painkillers until the bone shattered and damaged the tendon. He didn't realize anything was wrong until the bone started pushing out of his leg. The pain became unbearable, even with painkillers. Sadly, he lost his leg due to infection. On top of that, during his time on painkillers, he punctured both eardrums with Q-tips, developed infected hemorrhoids, broke 3 teeth from clenching them, and broke 2 fingers after slamming his hand in his car door. He was also using speed to counteract the sleepiness from the painkillers. He eventually became addicted to opiates and would steal from the hospital to feed his habit. Later, he crashed his car intentionally, killing a college student to get more pills. When the police searched his car, they found it full of stolen guns he had been selling. This was in Florida. 11. My mother treated a diabetic patient who believed she was allergic to water, so she only drank Coca-Cola. I'll never forget that one. 12. I used to work as a medical scribe in a pediatric office. One mother brought her daughter in, saying her skin was turning black. We were initially concerned about an infection or abuse. However, it turned out the child had just been tanning in the sun while playing outside. 13. I'm a nurse. One of my patients, who had just had 2 toes amputated due to uncontrolled type 2 diabetes, told me, "My blood sugar is only high when I'm in the hospital." I asked if she checked it at home. She replied, "No." I asked, "So, how do you know?" She answered, "I just don't feel like it's high." Me. 14. A nutritionist friend at the hospital told me about a construction worker in his 30s who collapsed one day. After being rushed to the hospital, they discovered he was severely nutrient deficient. When asked about his diet, he admitted that he didn't eat breakfast, skipped lunch, and drank beer instead of eating dinner. By the time dinner was ready, he didn't want it. He had been living off beer alone and couldn't remember the last time he ate solid food. 15. As a dentist, I once told a patient, "Please, do not superglue your tooth back into your mouth again." 16. As a NICU nurse, I worked with a family whose premature triplets had all been doing very well and went home. A few weeks later, all 3 were back in the hospital. It turned out the mother had brought one of them in for dehydration and fever. The baby's electrolytes were so unbalanced, it could have been life-threatening. After rehydrating and stabilizing the baby, we learned that the mother had stopped using the prescribed formula and started giving raw goat or sheep milk from Europe, which was not suitable for her premature babies. She was shocked when all 3 babies had to be readmitted for treatment. 17. My paramedic girlfriend once told me about a woman who frequently called for ambulances. She was a germaphobe and would swallow razor blades frozen in ice cubes, believing it would kill germs inside her. Fortunately, the stomach acid often dulled the blades. 18. I once had a patient who came in distressed because he had used a box of dirty syringes he found on the street to inject himself. He had no idea what diseases he might have contracted. I reassured him that we would handle whatever the test results showed. Miraculously, everything came back negative. When I suggested he get a tetanus shot, he refused, claiming that vaccines are dangerous and kill people. It was hard to remain professional at that moment. 19. I'm a lawyer, and during one consultation, a client believed she had lost her brain after a car accident. She was convinced her brain wasn't in her head anymore. Another client, a postal worker, wanted to sue the post office for being exposed to toxic chemicals from a leaking package. When I asked him to describe it, he said it looked and smelled like honey. The package was a can labeled Honey. 20. My best friend, who's currently in residency, had a patient with a festering wound on his face. Maggots had infested the wound, but the man didn't think it was serious until maggots started falling into his cereal.